How will that go? Well, we have our fingers on the pulse of that story. Moving on swiftly.
And to the Ministry of Health, the government has launched investigations after rejecting claims worth 10.6 billion shillings submitted by 10 health facilities due to fraudulent activities and non-compliance.
Other claims worth 3 billion shillings are being re-evaluated due to lost documentation, and others worth 2.1 billion shillings, and they are all under surveillance for further investigations.
Health Cabinet Secretary Adan Dualle says 728 health facilities have been closed down for non-compliance, 301 facilities downgraded by the Kenya Medical Practitioners and Dentists Council, and 45 facilities are set to be degazetted for fraudulent activities.
Kasichana Masha is the one on that report.
The Ministry of Health on Monday vowed to take legal action against any health facility, doctor and patient found to be involved in fraudulent activities after tens of facilities presented fraudulent claims worth 10.6 billion shillings to the Social Health Authority, an act that accounts for 30% of all payouts.
Claims worth 10.6 billion have been rejected due to fraudulent activities and non-compliance. This action is taken under the authority of Section 48(5) of the Social Health Insurance Act 2023, which outlines penalties for providers who knowingly or fraudulently alter information to defraud the authority.
Addressing the media on Monday at Afya House, the Cabinet Secretary for Health, Adan Dualle, disclosed that through the digital health system, they have intensified detection of fraud activities, leading to the closure of 728 facilities due to non-compliance, downgrading of 301 health facilities, and the degazettement of 45 facilities.
You will find the fraud can be detected and stopped at any point, including even at the point of payment. As our AI module becomes more effective with availability of more data, the more data we collect, the easier the detection of fraud becomes.
Among the fraudulent activities reported are upcoding, falsification of records, conversion of outpatient to inpatient, and phantom billing. Since the rollout of Taifa Care on 1st October 2024, 7.7 billion shillings have been paid under the Primary Health Fund against the submitted claims worth 9 billion shillings. Under the Social Health Authority, facilities submitted claims worth 82.7 billion shillings, but the ministry managed to pay 53 billion shillings. However, the ministry pledged to clear all approved pending billing, including those of the defunct NHIF.
This will be factored into the supplementary budget in October in full respect of the Constitution and other relevant acts, financial acts. However, claims above this threshold, and I repeat, must still undergo a very vigorous verification process.
Kasichana Masha, Prime Edition.
Help us get the